Okay, so this will be a quick CPD lesson on the core and how it's important to get this information across to your client so they understand why they're developing certain problems, and they will then respond to that and understand why you treat them the way you do, why you advise them the way you do, and why you rehabilitate them in the way that you do. And so patient education is so important because it allows the patient to understand and become part of their treatment, and they're then much more likely to stick to it. So before we proceed into the core itself, we've got to remember that the core, the name of the term core, is purely made up. All right, so it's a term that describes a set of muscles that have a common aim, and that is to support the body, support the spine, but also support the whole body. So without these muscles all acting together, and of course this is what happens to a lot of our patients, without them acting all together, you don't have what is called an efficient core, and you are more liable to hurt yourself in some way. So your brain doesn't recognize an origin and an insertion particularly. It will recognize a movement, all right? So a movement of flexion and extension and reaching out. It understands that, but it won't actually recognize an individual muscle itself. And of course, muscles do not work on their own. We describe it like that, but they don't act on their own, all right? They act as groups of muscles in order to perform a task or a movement. Okay, so let's just talk about some of the muscles of the core, just a little bit more. So at the top, you've got the roof. So you have the diaphragm between the thorax and the abdomen. Now, the diaphragm's the shape, and so when it contracts, it squashes everything down below it. So as we take a breath in and just use our diaphragm, your stomach's going to come out, okay? Because it pushes the contents of the abdomen forwards. So people who diaphragm breathe have a strong diaphragm, and therefore they know that the roof is strong. So at the base, you have the foundation, okay, of the building, which is the pelvic floor, okay? And so the two will act together. The whole thing acts together, but if we just take the top and the bottom, they will act together to maintain a certain amount of pressure within the system, which gives you stability, all right? So if there was no pressure in the system at all, okay, our spine would be under a lot more strain, and we're going to be a little bit like a spring, in fact, too much so. And so that puts a lot of stress on the structures above and below. So diaphragm, pelvic floor, again the same. All right. So if you hold your gluteals together and really hold yourself in, okay, and as if you're going to strain yourself a bit, then you're going to be using your pelvic floor, okay, and so that's going to toughen the system up partially. Then on the sides you have a big space, okay, so you have a big open space here. So if we take the rectus abdominis first, okay, going from the lower ribs down to the pelvis, so all the way down, so really long, okay. If you actually do a dissection and take the skin away here, you'll see a lot of connective tissue in and around the rectus abdominis. Now that connective tissue is there to offer more stiffness and stability, because we've got a lot of space here. So it's a bit like adding a bit of scaffolding or getting an RSJ in above a doorway or some scaffolding around a building to actually support it. That's the function of this connective tissue, okay? And it also gives the shape of the six-pack, the linear elbow straight down the middle, and then your kind of connective tissue in between the actual rectus abdominis muscle. Okay, giving it the six-pack appearance. So you have it there, all right? And then on the sides, basically you've got three muscles. You have the obliques, of which there are two sets, and you have the transverse abdominis. So we take the external obliques first, then hopefully you can see my pocket. Okay, so the external obliques run, like my hand, in this direction here. Okay, so they're in front of your spine and they're heading down into your pocket. Okay? Your internal obliques, so if you've got an external oblique, you must have an internal oblique. So your internal oblique are here, okay? And a bit like my hand, they run in this direction towards your back pocket. Okay? So their function, all right, is to help with side bending, okay? Help with flexion, and they help rotate your back. And a bit more about that in a moment. And then you have the transverse abdominis, so the famous transverse abdominis, all right? In the name, transverse, the clue is, if it's transverse, the fibers are running transversely to the floor. So like that, okay? So they come into the connective tissue here to hold you in, okay? Maintaining or helping to maintain, amongst all the other structures, the actual pressure within the system to give you that stability. Then at the back, although strictly speaking not a muscle, the thoracolumbar fascia at the back here of your spine, so just here, or around here, really tough stuff. Again, like the connective tissue at the front, offers you the stability. So it acts as a way for the transverse abdominis to attach to, but it also gives the whole structure that tightness that it requires, okay? So that's basically, very quickly, through the functions of those main muscles of the core. Now briefly, just a little bit more about the obliques. So we talk about external oblique because of how it attaches to the front of the iliac crest here. When it contracts, my left external oblique will help turn me to my right. Okay, to do that movement of this, my internal oblique here will help turn me to the right. Okay, so this rotates in a contralateral way, so left to right, or on this side, right to left. And the internal oblique, okay, on this side, acts in an ipsilateral way, so it will contract and it will help turn me to the same side, i.e. the right. So turning right, external oblique and internal oblique contract together to help me turn. They does involve the external rotators on the left-hand side and the groin muscles on the right. But basically, if we're just talking about core, that's basically one of their functions. Of course, both obliques will help flex, all right? And the transverse abdominis, of course, contracts in to hold the system together. To help hold the system together, to act like you know the weightlifters, you know, they come along with a great big leather belt, tighten it up, you know, they're going to do a max squat, all right? That's the transverse abdominis. Now, because of the functions of the core muscles, we can do something called pelvic tilt, okay? Now, the pelvic tilt basically uses your core muscles. So if you can't do a pelvic tilt, it might be that you've been out of practice, but after a few goes, if you can't do a proper pelvic tilt, then your core is not working properly. And before you do any exercise at all, any rehab, any give out, you've got to be able to achieve a pelvic tilt. So for instance, they could be a gym goer. No, I'm really fit. I go to the gym 6 times a week. You know, I got flipping huge muscles everywhere. My core's perfect, right? I'm sorry, but that person who cannot do a pelvic tilt, right, is not using their core efficiently, and therefore they're putting themselves at risk. So one of the first things I do is make sure that they can do a standing, not a lying down, but a standing pelvic tilt. So what are you going to look out for? Well, basically, you want to be able to rotate your pelvis back in a posterior fashion. So now no lordosis, okay? I should feel my glutes tightening and my rectus abdominis also contracting as a reflex. I then need to be able to anteriorly pelvic tilt. So stick my bum out basically, like this, using my rectus spinae, my multifidus, okay, to do that. Now, I need to coordinate that. So I need to be able to do it in a coordinated, repetitive way. Some of the compensations you'll see in someone is they will do this. They'll either try and do a pelvic tilt and bend their knees, because bending their knees helps them do it. This is the compensation. Or they'll try and do an anterior pelvic tilt like this, right? And they will extend their thorax and draw their shoulders backwards like that. So they'll retract the shoulder blades. Or what they might do is trying to anterior pelvic tilt, they will lean forward. So they'll either sort of do this, this, or even shrug their shoulders. These are all negative movements, which your brain is trying to compute how to do this movement, okay? And it will recruit whatever muscles it can to be able to do that. Muscles that have nothing to do with your core, all right? So these are compensations. So this is one way of knowing the effectiveness of someone's core. It's not the only way, but it is one way where you can start to find out. Now, if they're really bad at doing a standing pelvic tilt, and in fact they can't do it at all, good place to start is lying supine, all right, and trying to rotate their pelvis backwards so their lower back pushes against the floor, okay? Now, if they contract their abdominal muscles, they will do that, okay? So now you can see that I am anteriorly pelvic tilting, and now I'm posteriorly pelvic tilting. Okay, so to do this, I have to use my core muscles. Okay, so a lot of people can do this, all right? If they can't do this, you can get their legs up like that, hold them under their calf, and then they can, and just push against the table. Okay, then they can progress to here and bring it back and bring it up and bring it back. Okay, so and it's a progression. So from here, once they can do this reliably really well, then we'll get your client to stand up against the wall and do the same thing. So we'll do that now. So after teaching them to do a proper pelvic tilt, so anterior posterior repeatedly lying on the floor, you get them to try and do it standing up, leaning against the wall. Now, obviously, when you're lying down supine, the floor is helping you a lot. It's supporting your body. So all you've got to do is move it. Whereas standing up, we have to move the pelvis and support the core and the whole body at the same time. That's why it's much more difficult. So that interim stage is leaning against the wall. Now, the further away your feet go from the wall, the easier it is. So you might want to do this. Have them standing against the wall, shoulders, everything. Bring their feet a bit further forward like that. And then if you look here, I'm going to do a posterior tilt. So my back flattens against the wall and then slowly arches and creates the anterior tilt. All right, so if I bring my feet backwards, it gets harder. So I'll put them up against the skirting board. There, okay. Now, a bit more of a gap. Posterior, anterior. Now, if they're having a bit of trouble doing that, especially if it's a male and he's wearing a pair of trousers or so with a belt on, you can grab the belt, grab the back of the belt, or they can, sorry, all right, and pull it up. And that creates the posterior tilt because it's mimicking rectus abdominis, yeah? And then anterior is down, okay? Now, once they can do that, obviously then they can come away from the wall, hands on hips, say, and do a proper pelvic tilt. Okay? So the whole point of this is that once they can achieve it, and we know they're starting to use their core muscles to actually get their pelvis and their lower back into a good position, you then want to find that sort of neutral, rough neutral position, which is not fully extended, not fully flexed in the lumbar spine, but that happy medium between the two. And if you can find that, okay, it's an approximate place, but it's not locked, then the stress on the lower back is a lot less. So during exercise, squatting, all these things, okay, they've got to try and not lock the lumbar spine, which will often happen in people who have overreactive lumbar erector spinae. So, the significance of the pelvic tilt is during activities, life activities, you want to be able to optimize that positioning so it's not in a locked extended position and it's not in a fully flexed posteriorly rotated position. So there is this sort of neutral area. So for instance, I could be doing the hoovering, okay, and I'm locked, don't realize I am, but I'm locked into extension. This is stressing my lumbar spine, and every time I do the hoovering, my back aches. But if I lock it and then posteriorly rotate my pelvis and bring it back a bit, I'm in a much better position, and hey ho, I can hoover and not have any back pain. So the same thing. So it's the same thing with like a plank. So as a test, you can get someone to do a plank and see how they do it. Okay, first they've got to be parallel. Secondly, they must be locked into anterior pelvic tilt or in posterior pelvic tilt. There is that halfway house, okay, which is an approximate area, but that's where you want to be. Okay, so not the extremes. So if I did a plank now, I'm not brilliant at them, but okay, so lie down like this. Okay, this is a better way, but you can do it this way. All right, and then come up, I can posteriorly rotate my pelvis or anteriorly rotate it so it's locked. Now I don't want to be there, so I'm going to bring it off the lock a little bit, and that's where I want to be. Okay, this is going to benefit me much more. So the exercise is the test. I could do a side bridge. I could, and that tests the sides, so your transverse abdominis, your external, internal obliques. Okay, that's giving them a rough idea of their strength and their ability to do the motion. So if there's a large discrepancy between both sides, then there's your problem. All right, and then when people come in with like lower back pain, all these little routines I do, so planks, side bridges, all these sort of things, they all tally up, and you can start to see why they're developing the problem they're getting on the side that they're getting. Okay, it's amazing how it all comes, becomes obvious after a while. So side bridge, because they're difficult to do, we've got to be reasonable. So I get someone to do a side bridge on their side, obviously, say on the right side, with both knees bent, feet together. So I'll be on the floor, or they'll be on the floor, right, like that and like that. And we want to keep ourselves perpendicular to the floor. Okay, so if I come up, okay, all right, this is good. Okay, this is all right. Okay, it's as high as I can go. But on my other side, I might not be able to do it as well. All right, or if I do it this way, okay, or I'm like this. These are all compensations. So basically, with the side bridge, you come up and down like that. And again, do you lock your back? All these factors are really important. So in the initial stages, when you see someone, these sort of tests, if they are out of pain and they are more mobile and they can do them, they are really good things to try. Okay, so just before we finish, just a couple of things I'd like to get across to you is you see a lot of people when they bend down, you know, they overarch their back, they lock their back. This is because their rectospinae muscles are very dominant, okay, and they can't use here because they don't find it that they can, or they think they can, but obviously they're not. And this causes like the hyperlordosis, and actually this is bad. This is not strong back muscles. Okay, these are dominant back muscles compensating for something. So a weakness somewhere else. So look out for these things. Now I've not been able to show you every single exercise or assessment that I might use on a client, but I've given you a few which will definitely help you, right? And the thing is to develop your own style and your own way of practicing and your own way of assessing. I've done that over the years, and you should too. I really encourage that. Okay, so I hope you enjoy it. Use it. It might take a few weeks, maybe even a few months to try and integrate all this information into your practice, but I hope you do. And thank you very much for listening. Bye. So I showed you earlier on, I showed you some exercises you can do indoors. We mentioned the plank and the side bridge. They're both exercises and they can be assessments also. So here are some other things that you can do. I mean, there are innumerable amounts of exercises. So a couple I'll show you. One, you want to try and produce some twisting, because that's what your core does. It helps control that and make it not stressful on your spine and your body, okay? So one thing you can do, these are really light, these are 1 kilo each, so 2 kilos, okay? You can have your feet apart, okay? Make sure your pelvis is not locked, so we just bring it back a little bit, you know, so not in the locked anterior tilt, but just back, hold it like that. And you can do a twisting dumbbell exercise, okay? Here's your resistance, and you can feel your obliques actually being used whilst you're doing it. So here, so I can feel that, and here, okay? So really useful, all right? You could do it like that if you wish, but I think the first way is better, all right? So you can do that. You can take a medicine ball. This is quite heavy. This is well, for me it is. It's a 5 kilo medicine ball. Okay, and you can just do a lunge, make sure your knee's over your foot, okay, and just slowly move the ball left and right. Okay, keep it controlled, not jerky, and smooth. Again, this is the core exercise. I mean, there are loads, but this is just to help you a little bit. Lastly, these are heavier, these are 6 kilos. Okay, you can lean forward to engage your rectospinae a little bit, okay, and the glutes too. Just lean forward, don't overlock, just come out of complete lock in your lumbar spine a little bit, okay, and then okay, so look, these are just examples, you don't have to do them, okay, but they will help get you on your way, and then you can devise your own as you go.